Assalamu alaikum. So today we have our guest speaker, Dr. Sana Tariq, with us, and she has done BDS from Army Medical College, and she has done her HCPS from orthodontics, and her and she is currently the registrar orthodontics from High Tech Dental College, Texila. So without any delay, I would like to welcome our guest speaker, Dr. Sana Tariq. Assalamu alaikum, ma'am. How are you?
Walaikum Assalam. How are you doing?
Alhamdulillah, I'm fine. Ma'am, you can continue with the slide.
Today, I'm Dr. Sana Tariq, and remaining introduction has been given by Dr. Farooq. Today, I will be talking on dentofacial deformities and dentofacial deformities, what essentials we need to know about it, the basic things we need to know about it. So, the outline of the presentation would be like So, this would be the outline of our presentation. I would be talking about what is dentofacial deformities, why is it significant to know about these, and how do we manage them briefly. Then I'll show you a few cases. Then I would talk a little about why the lack of knowledge of such diseases creates headaches. Why is it hazardous for not knowing what are these diseases? And then later on, we are going to talk about the technological advances. Basically, the nature has given us all the pieces required to achieve the wellness and health, and it has left some of it uh, and we put the and allowed us to put these pieces to the maximum wellness. So, dental deformities is one of the types where God has done half of the job in form of clefts, and God has either done the job in um, inappropriate manners, like jaw deformities, big jaws or small jaws. So we are going to discuss them one by one. Next slide, please. So we will start from what are dental facial deformities. We are going to define them and elaborate them. Next slide, please. So it is a deviation from the normal facial proportion and dental relationships that are severe enough to be handicapping for an individual. They affect an individual aesthetically, functionally, psychosocially. They cause clinical signs of depression, and then they cause speech problems to an individual. This all results in significant decreased quality of life. So these are dental facial deformities. Yes, please next slide. We in these dental deformities, there come disproportionately big or small jaws, like we have in class 2 or class 3 malocclusions, very short or very long faces, asymmetric faces, and open wide faces. Besides these, we have cleft lip and palate that comes in syndromic and isolated forms. Then we have other syndromes that are associated with dental deformities, and many of them Eppers, Coulson's, Creature Pollen, Pierre Robin sequence, Mobius syndrome, and Dijort syndrome, and etc. etc. And then we encounter injuries, burn injuries, blast injuries, road traffic accidents. All of this it comes under dental facial deformities. Like this. So now we will discuss why management of such dental facial deformities is necessary. Why every person needs to know about them. May it be a general dentist, may it be a fresh graduate, may it be an undergraduate student, may it be any specialist of medical or dental field. Why we need to know about it? We need to know about these deformities as they cause severe aesthetic problems, and these aesthetic problems are handicapping for an individual. Everyone has a desire to look beautiful. So do am I. So do anybody else. You. And this is nothing abnormal. So if something is hampering your aesthetics, this is causing a significant reduction in your oral health related quality of life. And many researches have been published. I have shown one reference. There are millions of such references. Then second problem is function. Next slide, please. Functional disability. Uh, Patients with such problems, dental deformities, they have difficulty in opening their mouth, they have inefficient chewing, they have drooling of saliva from mouth, they are underconfident while they are interacting with people as the saliva drools out of their mouth while they are speaking. They cannot eat in public because the food comes out from their mouth, it drools from the corners of the mouth. So it causes significant problem for such individuals while they are interacting socially in home function as well. Next slide, please. Another significant problem that is caused by such deformities is the psychosocial problems. There is reduced social acceptance of such individuals. They are subjected to bullying in schools, homes, and workplaces. They are experienced to biased behaviors based upon appearances by teachers, by bosses, and anywhere, even at homes. Then they pose difficulty in marriages. They have reduced job opportunities. So it also causes a sheer depression, and usually these patients go into clinical depression. It's like this. Then we have another significant problem that is speech difficulties. Patients with such malocclusions, they have distortion in F, B, Z, and J sound production. Then people with having by having tongue tie, they cannot produce N, D, L, T, and R words. And with other malfunctional disorders, S, Z, Sh, Z, Ch, and J, these sounds are more or less produced as a form in the form of and so we call these individuals as these are toothletics. They produce just D sound in every sound they produce. Next slide, please. So after discussing what was the importance, why they need to be addressed, why it is significant uh, for an individual to be treated well in time and well in terms of all medical facilities that should be provided to them, we are now going to discuss the management. We have specialties that are involved in management of DFDs. These are orthodontics, maxillofacial surgery, dentofacial prosthodontics. Orthodontists, they align the teeth. Dentofacial, maxillofacial surgeons, they align the jaws. And dentofacial prosthodontics, they reconstruct the lost parts. Then we have plastic surgeries and dermatologies that work hand in hand with these dental professionals to bring optimum results. We need to do fillers, we need to do far revisions and so on and so forth, a lot of things. Then we have to do speech therapy for such individuals. They are unable to pronounce certain words properly because lack of development of the tongue musculature because of these deformities. Then we have psychosocial problems associated with them. These psychosocial problems are basically why we need to address these problems. Now I'm going to show you a few cases. Next slide, please. This first case is of cleft child. Uh, he reported to us on third day of birth. We gave him the appliance is given in the second picture, and this is called NAM appliance, nasoalveolar molding appliance. With this, we bring the lips together. We do the taping on the lips by attaching the elastics with this long part, and then we mold the alveolar segment inside the mouth. And then at third month, he was operated, and this fourth picture is immediately after operation. So, cleft lip and palate patients, whenever you encounter them, you should guide them towards the true course of treatment. Basically, these individuals suffer because they don't know how and where to get treated. So, this is very important for general public to know. This is very important for any undergraduate, postgraduate student to know, any house jobian to know, any specialist to know. How do we, who treats them? What is the course of treatment? It is not just to know how to treat them. It is not everybody's job, but it is everybody's job to know and to guide these individuals. Next slide, please. Second case is a true orthokinetic surgery case. This child was 21 years old and he has very big jaw, lower jaw, very big. He couldn't talk, he couldn't smile, he couldn't eat. We did maxillary advancement and mandibular setback on this patient, and the pictures on the right side are shown after surgery once. Next slide, please. This is the intraoral state of affairs of the same patient. He couldn't bite, he couldn't chew anything because of this malfusion. And the pictures on the right side shows immediately after surgery, we have given him at least adequate function. Next slide, please. This is a similar child who came to us in growing stage, and this child had tongue tie. And due to tongue tie that was not operated in early childhood, the tongue musculature went hypomobile, and it was continuously putting forces on the mandible, and the mandible started to grow in the downward and forward direction. We placed this appliance in his mouth, and with this appliance, we were able to manipulate the growth pattern into a favorable pattern. It's fine. Next slide, please. Now I will show you some cases of defect prosthesis. The lady in the first picture is shown with she had to get her eye removed for one reason or another. So it was socially handicapping for her to interact with people, to socially interact. So we gave her a prosthetic eye, silicone. This is made of silicone. She cannot see with it, but it is giving her an acceptable appearance to interact with society. Second picture is of an ear prosthesis. Next slide, please. This third case is of a nose prosthesis. This patient has some clefted nose or some accident. He lost one component of his nose. So, why is it important to know the management of such disorders? Lack of knowledge about management of such disorders leads to disasters, really disasters. Now I'm going to show you a case. Next slide, please. That was barbaric. This child was born with a disease that was self-limiting. This eye disease is self-limiting, and it corrects in the course of a 2 to 3 years period when the child becomes the age of 2 to 3 years. But due to the lack of knowledge, due to the inadequacy of knowledge, I must say, inadequacy of applied knowledge, some rural health center doctor removed his eye, and that was barbaric. And when this case came to us, and I was like really shocked and really distressed. I couldn't sleep for a couple of nights because this child has an entire life to live, and his eye is gone just because of ignorance of the doctor. So this is important for us: when to do what, or not when not to do what. It's like this. Now I will tell you what world is doing for such disorders. Next slide, please. We have cases of full facial transplantation going on in the world. We are not even at the starting step of this management of such disorders, and world is heading towards facial transplants. Next slide, please. Lots and lots of institutes are there. University of Michigan, Scotland, Glasgow, China, School of Somatology, Hong Kong, Tokyo, Japan. They are working on these disorders on a huge scale, and we don't even are at the first step of starting it. So it is important for us, all of us, to know to start to take that first step. Next slide, please. Next. This is the School of Somatology Research. Next. This is the Japan Jaw Deformity Society. Next. So here I would conclude that we should realize that what is our responsibility towards such uh, patients, towards such suffering people. We should know at least to to guide them to the true course of treatment. We might not be able to treat an individual wholly and solely, but it is our responsibility to guide them towards the right way. हमारे यहाँ जो लोग हैं वो बहुत इलिटरेट हैं, उनको नहीं अंदाज़ा कि ये सब चीज़ें ट्रीटेबल, इवन हमें नहीं अंदाज़ा, हमें स्पेशलिटी करने के बाद अंदाज़ा हुआ है, तो हम लोगों को ब्लेम नहीं कर सकते। हमारी अपनी रिस्पॉन्सिबिलिटी हमें पहचाननी पड़ेगी कि हमें पता होना चाहिए कि ये चीज़ें ट्रीटेबल हैं, who is the person responsible, orthodontist, prosthodontist, oral surgeon, even plastic surgeons. You should refer these such patients to such doctors. They are going to take good care of them. वो जो काम नहीं कर सकते वो आगे खुद उनको रेफर कर देंगे, बट वी आर एज फर्स्ट हैंड हैंडलर्स ऑफ दीज पेशेंट्स। जो क्या हम आरएचसी में डॉक्टर्स होते हैं, हम डॉक्टर्स नहीं भी होते हैं, हम जनरल पब्लिक के साथ इंटरेक्ट कर रहे थे, हमें पता होना चाहिए कि हमें इन मरीजों को किसके पास रेफर करना है, कहाँ भेजना है। सो दिस आई थैंक यू फॉर
Thank you, ma'am, for the great presentation. It was very great topic, and thanks for your valuable information and time that you shared with us. So, inshallah, I hope कि सबके लिए presentation बड़ी useful होगी जो जो सुनेगा। बाकी मेरा बस एक यही था इसमें इंटीग्रिटी थी कि जस्ट के जिस तरह हमने पढ़ा है, हम खुद भी लाइक अंडरग्रेड लेवल पे थे, तो हमने सिर्फ इसको थोड़ा इस तरह पढ़ते हैं लाइक वी जस्ट नो के ऑब्चुरेटर्स होते हैं, मैक्सिलरी ऑब्चुरेटर, या ये डिवाइसेस होती हैं जो कि प्रोस्थेसिस है, जो कि हम इस तरह के चाइल्ड जिनको लाइक क्लेफ्ट पैलेट इश्यूज होते हैं उनको हम बना के देते हैं। बट द थिंग इज लाइक on undergrad level, just we like read it, and we just read it for just to pass the exam. बट इस पे लाइक हमें लाइक अंडरग्रेड से हमारी हमारी ट्रेनिंग इतनी अच्छी करनी चाहिए कि हमें पता हो कि इस तरह का लाइक पेशेंट रिपोर्ट हो हमारे पास ओपीडी में या कभी अस्पताल में, सो व्हाट शुड वी नीड टू डू, बिकॉज जब हम पोस्ट ग्रेजुएशन के बाद या बेशक ग्रेजुएशन के बाद ही लाइक हम जब एज अ जनरल डेंटिस्ट होते हैं, सो सच पेशेंट कम एंड देयर पेरेंट्स कम जिनके लाइक बच्चों के क्लेफ्ट लिप एंड पैलेट होता है। सो उस वक्त हमने शायद इस तरह पढ़ा नहीं होता, तो हमें समझ नहीं आ रही थी कि हाउ टू प्रोसीड। तो बेसिकली हम सिर्फ फिर रेफर कर सकते हैं, और रेफर भी हम सिर्फ ज़्यादा से ज़्यादा ओ में फिक्स कर सकते हैं, लेकिन हमें कुछ थोड़ा बहुत पता होना चाहिए कि किस तरीके से इसको प्रोटोकॉल को लेके चलना है। सबसे पहले किसको रेफर करना है, जैसा कि आपने एक स्लाइड में बड़ा अच्छा बताया कि जब क्लेफ्ट लिप का
ideally these patients should be referred to orthodontists.
ऑर्थोडॉक्स, ओके ठीक है मैम,
Orthodontists, they are going to plan their treatment.
सही है, ठीक हो
Ideally
गया,
they should be sent to them.
ठीक है मैम। थैंक यू मैम, बहुत बहुत शुक्रिया आपके टाइम का, बहुत बहुत शुक्रिया आने का। खुदा हाफिज़, ख्याल रखिएगा मैम।
Thank you, Ji. Thank you.